My name is Esther C2. I'm a health education manager at AAMG. I would like to advocate one important thing. It's the topic of hoarding. Hoarding sounds like it's a social issue sometimes. It could be a style of living, but I would like to share with you a personal case, a case that I have witnessed for one of my patients. And this is not just a way of living. I hope this case will teach you something. So I have a patient who has suffered asthma for a few years. Prior to that situation, she's always healthy, never had asthma. But a few years ago, she developed this incident. And ultimately, the situation got worse and worse. She from one medication for asthma to 5 medications for asthma, but still not able to control the symptom. So she's under my care, and through the discussion of situation that she experienced, I realized that the situation, it may be something related to the patient's home, because she is living in a very cluttered area, a home that is full with matters. Like she likes to collect things from the street. She also likes to collect cans. And the area she lives, it's actually very humid, foggy area, like a typical San Francisco home. So because there's a lot of matters in the home, so it increased a lot of mold incident in her house. And she had to admit that she was never a hoarder a few years ago. That all happened because she lost her loved one, and she used collecting garbage as a coping mechanism to manage his anxiety. And ever since then, she actually recognized that prompted her to develop this ultimately severe asthma situation. So after this, knowing that mold is actually one of the very key factors for people who develop asthma, or even mold can exacerbate the symptom of asthma. So knowing that could be a problem. So I have talked to her family member and also herself and motivate her to clean up the house, to recognize, clean the house, clean up the mold, so that she can ultimately live in a mold-free environment. And she take that into consideration. She have her caregiver clean up the home and clean up the mold and buy some dehumidifier to make sure the mold would not grow in a humid environment. And after a few months, she come back to see me. She actually told me that her symptom has gone a lot better. She was able to manage with less and less asthma medication. So this situation, she actually very thankful to me that by just simply cleaning out the home and reduce the mold in the house, almost saved her life. So I'm actually really thankful for her to tell me the story, so that I can tell you the story, so that you can tell others. So this story, it's just not just a simple anecdote, but it's actually a very critical information to make sure that you can actually share with others, if anyone who have hoarding issues, so that you can actually help to motivate them to make some lifestyle changes so that they can change their life. So we actually making a video to help educate others to understand the importance of the hoarding problem, and also how to manage and resolving the cluttering problems. So I hope that you enjoy this video and also share this video with others. Thank you for your participation. If you have any comments, any suggestions, please comment below so that we can partner with you to make a better environment for our community. Thank you so much, AAMG. your health companion.
According to the local news, in 2015, a 90-year-old woman was found mummified in a house in San Francisco. The woman had passed away for 5 years until she was found. When the firefighters entered the house, they had to wear oxygen masks because the house had a foul odor due to clutter trash. This horrible event happened because her daughter didn't want to let go of her mother, so she kept her deceased mother in the house all those years. This case is just one example of what hoarding disorder can lead to. After learning about this case, you might be wondering, what other problems are associated with hoarding disorder and why should we care? First, let me ask you a question. Have you seen rooms like these before? These images are examples of hoarder houses. Does it make you feel overwhelmed, nervous, perhaps claustrophobic? These are some of the negative emotions caused by hoarding disorder. However, there are other problems associated with hoarding disorder. Before we talk about the problems though, let's learn about what hoarding disorder is. According to Mayo Clinic, hoarding disorder is the difficulty of throwing items away because you think you might need to save them. Some of the most commonly hoarded items include newspaper, plastic bags, cardboard boxes, food, and clothing. There are many signs and symptoms of hoarding disorder. For example, sleeping with items on the bed, having difficulties organizing and categorizing, over-shopping or collecting free items, and spending time moving items from pile to pile but not throwing them away. Usually, the first signs and symptoms of hoarding disorder happen at ages 11 to 15. Then, the symptoms will become more severe and harder to get treated as they grow older. In other words, people with hoarding disorder should get treated as soon as possible. Also, hoarding disorder is more common among older adults than younger adults. For example, the number of people who are ages 55 to 94 and diagnosed with hoarding disorder is 3 times the number of people who are ages 34 to 44 and diagnosed with hoarding disorder. Depending on the person's sign and symptom, there are 5 levels of hoarding that can affect the living condition. For instance, having a few cluttered items is considered level 1. On the other hand, if hoarding level is elevated to 5, the living condition gets worse, such as cluttered items filling the bathroom and kitchen, or even human feces on the floor. Even though hoarding disorder can affect people's living condition and health, why are people still hoarding so much? Well, there are some reasons that they are having difficulty throwing things away. They believe that they will use these items in the future and don't want to waste anything. Another reason could be that the items carry special meanings and are unique. Some people clutter items because they feel safer when they are surrounded by the items they save. Although we know why people are cluttering items, we don't know what is the actual cause of hoarding disorder. However, genetic can be one of the possible causes of hoarding disorder. In other words, it can run in the family. Moreover, stressful life events such as the death of a loved one and divorce can be one of the possible causes for hoarding disorder. Now, let's talk about the problems associated with hoarding disorder and why we should care about it. Hoarding items can lead to increased risk of fall, family conflicts, depression, poor work performance, and affect children's social development. Here is another example of hoarding cases filmed in the American documentary television series Hoarding Buried Alive. A married couple was not able to bring their newborn baby to their house because it was cluttered with more than 12 cats and trash. The environment was horrible and would have harmed the baby's health, especially because the baby was delivered early. Therefore, the baby had to stay in the hospital until the house was clean. Also, other residents of the hoarder house were affected. A little girl claimed that she was always getting bitten by bugs and saw dead rats in the house every week. This case shows that hoarding disorder can affect not only the owner, but also the neighbor and even the community. After knowing what hoarding disorder is and the complications of hoarding disorder, let me share some tips on how to declutter items in your house. First, you should start taking action. If you only sit down or lay on the bed, the items won't disappear by themselves. Second, make a plan of how you can declutter. For instance, how many times will you declutter within a week and which area of the house will you be working on? Third, you should start buying things that you don't need. Fourth, you should start little by little. It is very hard to clean the entire house within a day. You'll be physically and mentally tired. You can start cleaning for 30 minutes per day, then, over time, increase the amount of time cleaning. While cleaning, identify any unnecessary items and throw it away or recycle it. These items can be old product packaging, expired medicine, used food containers, and outdated newspaper. Next, start decluttering the room that bothers you the most but doesn't overwhelm you. To keep the motivation for decluttering, you can play some music while cleaning or ask friends and family members to help you declutter together. Most importantly, you should turn off your phone notification so you won't get distracted while cleaning. Besides decluttering, there are some possible solutions that you should know in addressing hoarding disorder. The most common solution is to attend cognitive behavioral therapy, in which patients will learn how to declutter unnecessary items with less stress and develop organizational and decision-making skills. Another solution is to participate in the family as motivator training, where family members are trained to assist the person who has or may have hoarding disorder. People with hoarding disorder can also attend skill training, in which they will learn how to organize their items within their homes. Last but not least are group treatments, either professionally led or peer-led. If professionally led, professional therapists will guide participants on how to address hoarding disorder. A peer-led group treatments a group led by a person who had hoarding disorder before and share their experience on how to overcome hoarding disorder. So, what can you do to help if your friend or family member has hoarding disorder? Let's begin with some tips on what you should not do. First of all, you should not just go into their house and remove their items without permission. This would be a civil rights violation and it can't solve the actual problem. After you throw away the hoarded items, it doesn't mean that they realize hoarding is a problem. They might continue to clutter unnecessary items in their house. In addition, it will negatively affect your relationship with them. Most important, it can increase their anxiety, depression, or worse. It is important to keep in mind that you shouldn't be judgmental. For people with hoarding disorder, they usually feel guilty for their living environment. When you're judging them, it will only make the situation worse. Therefore, when you are trying to help your friends or family who have hoarding disorder, it is important to know what actions you should not take. Now, here are the actions that you should take to help them. You should help them get information on how to address hoarding disorder. Communicate with your family and friends about hoarding disorder by listening to them and letting them explain why they are keeping the hoarded items. For example, does the item have special meanings to them? You can also make them realize that their house has limited space due to unnecessary items, which means they can't invite you or other friends to their house. This might make them realize the problem and start thinking of decluttering unnecessary items. Last but not least, you can refer them to cognitive behavioral therapy for help so that they can learn how to address hoarding disorder from a professional therapy. Finally, there are other organizations that help people with hoarding disorders. For example, the International OCD Foundation provides support groups, therapies, clinics, and organizations that address hoarding disorder. Another organization that addresses hoarding disorder is National Alliance on Mental Illness, aka NAMI. NAMI provides free peer-led group treatments for participants to learn about the skills that they need to address hoarding disorder. The Anxiety and Depression Association of America also provides resources for people who are diagnosed with hoarding disorder. I hope you learned something about the hoarding disorder in this video, such as the signs, symptoms, complications, and tips. If you like this video, please check out our other videos on organization and fall prevention on this channel. Make sure to leave a like, comment, or share this video. Subscribe and click the bell to get notified of when the latest video go up on the AAMG YouTube channel. Follow us on our social media platforms to keep up to date on the latest health news, free health workshops, and community events. Thank you for watching.